Hello, everyone, and welcome to the G7 Research Summit on the future of digital health. And thank you for joining us for a very, very important session dealing with data governance, scope, reliability, and access. My name is Ed McCauley, President and Vice Chancellor of the University of Calgary, and I'm honored to be joined by three illustrious panelists whose biographies appear in our program: Reza Deber, Kim McGrail, and Yves Joannette. I'd like to welcome everybody to the session. During the session, there'll be a place in which you can pose questions. Please post your questions and we'll try to get to them as many as possible throughout the program. We have some really important issues to discuss around data governance, scope, reliability, and access. And what I'd like to do is let's get right to it. Each of our panelists are going to give about a 5 to 7 minute presentation, trying to touch on some major issues associated with the topics. And then what we'll do is open it up for a question and answer period where we'll try to get as much information on the table as possible. So with that, what I'd like to do is to pass over to Reza for her opening comments.
Thank you very much. One of the things we were asked to look at as preparation for this is the Science Academy Statement 2020, which talks about the need to have global cooperation to ensure that technologies for the governance of digital health are actually going to be trustworthy and that their benefits get shared across society. So in this session, we're going to be talking about some of the issues involved in managing how you implement policies to govern digital health. And there's a key advantage of digital health, which is also a key problem, which is that digital geographical boundaries just don't have the same type of meaning. And it's very clear in the age of COVID. I mean, look how far all of us had to travel to come to this conference, right? Which is to one room in the house. So some of the issues involved in things like who's got jurisdiction over what, who's regulating what, who's paying for what. And if you want to enforce these regulations and policies across boundaries, what are the sort of mechanisms that need to be in place? And as has been briefly mentioned in some of the morning sessions, these boundaries are not just international, they're within countries. With Canada, the provincial territorial boundaries are key in trying to decide how we're going to do things. And the infrastructure that you put in place around digital health don't always fit the boundaries. Another thing that's important to clarify is that the rules and issues we're talking about are going to vary by the type of digital health activity you're talking about. And I'll give a couple of examples. One is the information. Where do you store it? Who's got control over it? There was some nice discussion of it this morning. What are the rules about ensuring that that information is accurate? What about who gets access to what? What about data privacy and consent? For example, could your employers be notified if you're diagnosed with a condition that might cost you your job? Could your private insurer be notified, which might affect what your coverage is going to be? Another set of questions get into things like disease and injury surveillance. How could and should you use it to track disease? Look with COVID, how do you know who's got it, who's going to be spreading it? What are the risks and benefits to people out of doing it? There's another set of issues I haven't heard talked about much, but it's using digital health to provide remote services. And telehealth is a key example, because one of the interesting things in the new era is that providers can treat patients from anywhere. You don't have to be in the same community. But if you do that, how are you going to pay them? Who's going to pay them? Where are they going to be registered? And in the early days of telehealth, it's one of the things that really made telehealth progress a lot slower than it could have, because doctors had to be licensed in the same province where their patients were. So there had been some plans they had to set up clinics in larger cities that would serve underserved populations outside their province, particularly in the territories. But they couldn't do it because in order to see those patients, you had to be registered in every single community, every single province or territory where those patients would come from. And there was also, how would you pay for it? But another advantage of that type of regulation is it protects you against clinics run by unqualified providers, that somebody can't just put out a clinic and say, oh, I do X, with no indication that they actually do it properly and none of the regulation. There's another whole set of issues. We've been talking a lot today about the predictive algorithms. So how do you make sure the data is accurate? How do you make sure that the algorithms are accurate? How do you make sure that they're not prejudiced? I mean, there was some US examples in which the algorithm systematically showed bias against particular races and ethnicities because of the way the data was collected. The issues also vary by who's involved. And one of the things we've done a bunch of work on is the public-private mix. So which activities data are controlled, regulated by private organizations? For example, they had some interesting things in the United States where these fitness trackers, you had optional fitness trackers that insurance companies said, oh, if you use this fitness tracker, we'll have discounts for you if you have the proper health thing. So, I mean, is this appropriate to be having these private companies monitoring number of steps you take or that sort of thing? And they had quite a few examples where private companies were controlling the data and using it in ways that people might consider discriminatory. Are they regulated by provincial local bodies? Are they regulated by national bodies? And then particularly when you get into personalized medicine, how many people are affected? Because one of the things that's well known in healthcare is a tiny number of people account for most healthcare costs. So the high users. So the things that affect those of us that are pretty healthy are not going to be the same as the ones that affect a small number of very sick people. And again, if you have private insurers, will you allow them to use that to cherry pick and decide who they will and won't insure? Because you don't have to avoid a lot of people in order to save a lot of money. How can you implement mechanisms that let us control digital health when they're crossing national boundaries? Because there's almost no international bodies with the power to do that. We're trying to talk about putting together organizations, but what levers do they have and how are they going to do it? And an obvious example is data storage. Let's say you set up rules in your jurisdiction. What protections do you have against data stored in other jurisdictions that have different rules? And the final line, and I'll hand it over to my colleagues, is it's really important to balance the risk of stifling innovation by overregulation with the risk of harm by underregulation. And the balance is going to differ a lot depending on what you're talking about. So thanks.
Kim, over to you, please.
Great. Thank you very much. And thank you for the opportunity to be here. So I think I'd like to start by kind of framing the way that I come at this issue really with this question of why is data governance in the context of digital health so important? And I would say that when I use slides for this kind of presentation, I usually use a picture of Dorothy entering the land of Oz, sort of opening that door from the black and white and seeing all of the color. And that's because fundamentally, I think the issue here is that the future is not the past, which means that we have to think about things a bit differently. The tools that we have in existence may not be suitable for everything we want to do in the realm of data governance. So why do I say that? For one thing, there's this basic fact that there's so much data now because everything has been digitized. So this is where we get to the idea of big data and the volume and variety and velocity of that data and how they move around. There's also a broader array of people, companies, as Reza said, there's private sector, public sector, individuals are data generators and also data users and also data governors. So there's just a very different sort of context of players that we have to think about and think about how to work together in all of this. And then there's also AI, which is the subject of a previous panel, and the fact that the AI uses data in a different way and produces different kinds of results. And really that connects to this idea of the fourth scientific revolution. So the idea there is that, the fourth industrial revolution. So the idea there is that we had three industrial revolutions that took us through mechanization, which was steam, mass production, which was electricity, and automation, which was computers. And the fourth now is this technological fusion, and I'm going to use a quote here, that's blurring the lines between physical, digital, and biological spheres. So again, just to underline, the future is not going to be the same as the past, and so we probably need to change our tools to think about that. So in terms of data governance, I think one of the just highlights I want to bring here is that digitization in this new world means that mistakes have far-reaching consequences. So if you let the genie out of the bottle, we make a mistake with data in the digital world, it's not the same as losing a single file, which might reach one other person. And the mistakes also are very, very difficult to be undone. So I think we have to think about consequences perhaps a bit differently. And perhaps in relation to that, and this is a theme that's been heard throughout the day, we really need to have a multi-stakeholder approach to this and a very, very strong inclusion of the public and thinking about how we want to structure data governance because of these changes, because so much of society now is really still resting on sometimes old legislation. Sometimes in British Columbia, for example, where I am, the legislation that we have to protect privacy was written in the early to mid 1990s, which means that it was prior to the really strong proliferation of the internet. So is it going to be up to the task today? I'm not saying the legislation is bad. It's actually a very good piece of legislation, but it doesn't contemplate everything that we're contemplating today. So we get to a situation where what's possible perhaps stretches beyond what we understand to be understood. It may be legally permissible, but it may not be consistent with the norms and values of society. And so that's part of the reason that we really need to include the public in a very meaningful governing sort of way. On the scope part of the title for this session, I think it's really important to acknowledge that no one organization or group or even one sector is going to have all of the data that we might be interested in bringing together for any particular purpose. And furthermore, we have to really widen the frame to consider communities as well as individuals. So we've often in the past really focused on individual autonomy as a goal of data governance. But I think increasingly we're seeing that communities deserve that autonomy as well. We can use that same word there. We also have to really concentrate on understanding both the rewards that can come from new data use, but the risks as well, and be mindful of unintended consequences, because a lot of this is moving pretty quickly, and I think we can't really contemplate everything that might happen. Another thing I would say in scope really is that data governance and data access require infrastructure, and that's physical, technical, policy, and human infrastructure. And we have to find a way to fund that. So this is where I think the themes of data governance butt up against a whole bunch of other themes in science around open science, science infrastructure, the need to assure reproducibility, which means the greater need to share, and frankly, just a need to do science differently than we have been doing it in the past. And finally, on the scope piece, I would say that the future is really going to probably be in distributed infrastructure and distributed analysis, which is going to make things like metadata really important, and I'll just leave that there. We need to make sure in terms of data governance that we have a functional and transparent system with clear and consistent rules, like the 5 safes that Alan Katz talked about this morning. And we need to make sure that access to sensitive data has additional steps wrapped around it. So, for example, if we want to use race-based data or gender-based information or information that's sensitive in any other way, that should come with community support and with things like equity impact assessments and clear demonstration of community engagement and understanding that we will use those data to improve the circumstances of the people that are represented. And with that, I will leave it there for now and turn it over to Yves.
Thank you so much. So I'm really honored to participate in this panel with such respected colleagues. The future of digital health is in fact today, but are we ready? So I would like to, among other things, just mention the excellence of the G7 Academy statements, just as Reza mentioned it, brisk, inspiring, to the point. I was looking at it, and And figure 2 provides a summary of the infrastructure requirements for progress in digital health. And out of the 11 elements of that figure, well, 6 are clearly related to the data cycle. And we heard this morning that data is the basis of all this enterprise. So Reza, Kim, and other colleagues this morning raised a number of points relative to the data cycle, capturing the data, reliability, storage and access, governance, the FAIR principle, and we also heard from Jennifer Walker from the indigenous population, the CARE principle, and all this, of course, in a responsible approach, respecting privacy and in line with equity, diversity, and inclusion principles. But discussions such as those we have today tend to slightly overlook the differences between different health research environments or milieu, and between jurisdiction and countries, even though it has been raised a lot. So let me share some thought with you, ending up with a suggestion. First, let's focus on academic health research, the one done in labs and universities and so on. And there, digital data capture is usually fine, even though some research teams need help to have good tools in order to capture and to really express their methodology in a digital way. But at the level of data management, level of governance, generally speaking, there is a lot of differences between researchers, between research labs, and between universities. Data governance is really different from one university to another, some of them not always understanding their trustee role regarding data today, or at least not having implemented it in clear and disseminated and understood policies. If we look at public health data, governance is certainly clear, but can also represent a limiting source for access to the public health data due to the level at which the risk it can be tolerated or managed. And we heard about this tension this morning a lot. Hospital level public data, those from, let's say, electronic medical records, are also under strict governance framework at that level, but the challenge can also occur for the capturing of data. For example, it is not infrequent that the EMR would contain clinical notes that are scanned from handwritten ones, or that one could find one of those good old faxes digitized and integrated in the electronic medical record. So in general, there's still, in many jurisdictions, silos between the hospital level and the jurisdictional level, let's say the health system level, and not to mention the data curation. So the situation regarding the data life cycle in academia and public health milieu is somewhat daunting, maybe discouraging, with lots of differences between universities, between hospitals, and even in a given jurisdiction, and between jurisdiction as well as countries. In the background, the backdrop, training for all those involved along the data cycle is absolutely crucial, including health professionals and workers, which is in fact a real challenge at this point. Now, one way to turn such a challenge into an opportunity is to create more policies, practices, and tools, sharing spaces, and to encourage comparative collaboration efforts. Such sharing spaces and collaborative efforts have to include all of the actors, from researchers to policymakers, as well as health service providers, from clinicians to citizens. But there has to be some encouragement, otherwise said carrots. Extra money is one, but the perspective of saving money is another, let's say a cost-efficient enhancement. And of course, the perspective for a better health for all is the ultimate one. So this Royal Society G7 meeting, I think, is a perfect standing point to ignite a series of collaborative efforts between universities, including their affiliated hospitals and between those hospitals, between health jurisdiction. It was mentioned and reminded this morning, we have 13, which is a challenge. It's also an opportunity because we have 13 to compare and to learn from each other. Between G7 countries and beyond, since where we have a diversity of digital health research environments and capacities, and of course with EU countries where there are already inspiring collaborative research programs. Always keeping in mind the non-negotiable respect for privacy of data, and the importance to have equity, diversity, inclusion expressed in those data and to involve the ecosystem. If I was to paraphrase an old sentence that I learned when I was trained, EDI or non-EDI in, non-EDI out. And you can replace this with what you remember. So digital health does have a bright future, but if we do it together.
Thank you. Those opening comments from the panelists clearly demonstrate the incredible breadth and extent of the topics that we're dealing with in this session. And I know that the topics around data governance, scope, reliability, and access are all interrelated. But what I'd like to do is to start out maybe posing some questions around the issues of managing the implementation of policies for governance. So if we deal with the data governance piece just initially, and to get the panelists' views on the issues around that, but also some of the insight in some of the complexities of who has jurisdiction over what, and what sort of mechanisms would need to be in place to allow enforcement across the boundaries which each of our panelists mentioned. So I'll just open up to the panelists who can pick up the answers to those questions.
I think it depends a lot on the issues you're talking about, because the rules around what do you have in a medical record are not the same as, what information do you have about spread of infectious disease, are not the same as, so it depends a whole lot on what you're talking about.
Eve or Kim?
So I think this relates to the comment I made about the fact that there's not any one institution, organization, actor that really has all the data that we need. So if we're starting to talk about complexity, that's part of the underlying piece of the complexity, is that we're trying to move a multi-stakeholder, multi-unit complex system. Yeah. So if we think about who has jurisdiction, I think it needs to be clear at an individual data set level, but then we should be able to create building blocks out of that. Yeah. And the language that we're starting to use in the data governance space is about data trusts or data cooperatives. There's a lot of different names that are being used, but the idea of these is that you don't necessarily bring all your data together into one physical location, but you create some sort of multi-stakeholder, multi-tenanted organization, which doesn't have to be a formal organization, but a collective that understands how it wishes to share data and make data available. You work out the rules ahead of time so that when an individual researcher or team of researchers comes along and wishes to have access to data, you understand how to make that happen. So it's building a repeatable process for data access and data governance that recognizes the multi-stakeholder nature of both aspects of the needed governance, but also who has the data and the jurisdiction over the data to begin with.
Eve?
One aspect of this which is important is managing the change process or the evolution process. And since we're talking about humans here, managing data, and since we're talking about policies that have to be implemented, we have to keep in mind that those that will be targeted by those policies should be involved upstream in the process in a very specific manner. Always remember the strategic planning expert that was always telling me that the best strategic plan is the one that you put in the shredder at the end of the process, because you don't need the plan. You need to involve everyone in order to adhere to the plan as it is being constructed. And I think and that's why it's so important to involve the researchers, the public, all the health service providers into these plans in order to create this together, a kind of a co-creation, because if not, it won't fly.
Right. So can we start
right. Another thing is the cost of being able to get access to the data. because look at how few examples in Canada can work in more than one province, because the whole procedure of trying to get access to the administrative databases, in some provinces, it's extraordinarily expensive to be able to do that. And again, I'm not sure if other jurisdictions have quite the same sort of hurdles that you have to be able to do that type of administrative research.
Can I come back to, Kim, you talked about the individual piece, which is very important. And then you talked about making the rules. And then Eve talked about the fact that we had to have a whole bunch of individual organizations, people, and so on, who is actually going to make the rules? And how can we create the environment in which those rules can be sort of tested, validated? And to Ray's point, do we develop 13 separate groups of rule makers across our country and somehow try to integrate across that to the whole? Or do we start with the whole? I'll open it up.
It's easy questions. I'll go ahead and start on this.
Nobody said it was going to be easy.
No, it's fun. So the rules have to really, they come from the groundwork of legislation. So that has to be our starting point. What is legally permissible, we can't go outside the bounds of that, but that's still pretty broad and pretty encompassing. But it kind of already gets to the other part of your question, which is, can we do this the same way across the country? And because our legislation is a bit different, fundamentally a lot of similarities, but with some differences, it probably means that we can't do this as one thing. Then there's an ethics layer. So in the research world, we live under the Tri-Council policy statement, and that sets some boundaries as well. But then I would argue there's another layer on top of that, because there's still, there's the kind of value-based things where we get up to the edges of what we know is legally permissible, ethically also perhaps permissible as well, but maybe isn't consistent with the norms or expectations of the public. So I think we have to be working with the base layer of legislation, the guiding principles of an ethics and an ethical framework, but then we have to fill in the specific rules around the edges of that framework with the involvement of the public, with the public having real power to say, actually, I don't want you to link my genomic data with other data and sell it to private industry. I'm not saying but that's a pretty consistent thing you hear from the public, is that they get a little more nervous when we're talking about profit motivations within private sector. So I'll leave it at that.
Great. Before we go on to Eve and Reza's response, one of the questions that just emerged from the audience as you were speaking, Kim, was how can the public be consulted, and what does that look like, and who do you mean by, the public?
Well, this is I'll keep this really brief, but this is a whole thing in and of itself. I feel that a good way to do this is through a deliberation process, which would mean bringing a diverse group of people together, giving them some background information so that they can deliberate with the necessary information for the topic that you want to talk about, and let them come up with the rules. And then I think scientifically we need to figure out how to validate what those recommendations are that come from the public. But I think that is one way that you can go about doing this.
Eve and Reza, did you want to comment on making the rules?
Yeah, just on the involvement of the patients. So again, each of the 13 jurisdiction in Canada certainly has things that could be inspiring for the others and vice versa. And one thing that I think is quite inspiring in Quebec and in my universities is that we're probably one of the few university where there's a there's something called CEPP, Centre d'Excellence, Patient, Partenaires, Public. And this is really embedded in the university, embedded in the Faculty of Medicine as a excellence center for doing exactly what Kim was saying, a deliberating approach. And this should be inspiring for the rest. And so that's why what I was thinking when you were asking, Ed, where should we start with in trying to connect these 13 jurisdictions, I think we should start where we have a little thread of that we can follow. And for instance, there is some FTP table, federal, provincial, territorial tables in health. They're probably at the too high level, but if we could use some of those tables to think of more closer to the ground, looking at digital health and looking at specific things such as access to data, I think we could all benefit from it. Certainly the jurisdiction where I am.
Another thing we have to be careful about is assuming that the public is somehow homogeneous, because policy analysts talk about the difference between diffuse and concentrated interests. And the question about who is going to come to a public consultation, they're not necessarily going to be the same people they're not going to reflect all of the viewpoints. There was a classic example they had in Ontario where they were trying to look at home care. And it turns out that what they were talking about, the people who came to the consultations were the people with rather low needs, because the people who had high needs patients couldn't make it to come to the consultations. So the whole policy was put together on the wrong assumption of what sorts of care was going to be needed in home care. And it turns out that when they set it up, that wasn't at all what happened, because those people hadn't come to the consultations. So I think it's important not to think that there's also what they call astroturf groups, which are the groups that pretend to be grassroots, but they're really artificial groups funded, say, by pharma. So certainly on should you pay for pharmaceuticals, you'll often find groups coming out arguing that infinite amounts of money should be paid for products because they're being paid by the pharmaceutical industry to make that case. So I think, trying to get participation is super important, but not as simple.
So I want to come back a little bit later to the public-private piece, but maybe the panelists could address the issue that, yes, we're talking about what's happening in provinces and territories in Canada, but this problem in particular has an international dimension. So how do we deal with another level of boundary issue in terms of legislation, ethics, as well as reliability pieces? So I'll just open up to the panel.
Well, certainly, I think that we have to organize specific international symposium, including G7 countries and beyond, in order to really focus on some of those important issues and come up with some best ideas, not best practice, but best ideas that could be shared, and maybe some kind of white paper each time on each of those ideas. I think we also need research. We need to think about it. We don't, all the answers are not there, and in that sense, I was always very impressed with the country-initiated joint programming initiatives in Europe, where a bunch of countries could decide to work together, put a little bit of money that goes to their own researchers, the money does not cross boundaries, and bring together on a peer review base a group of researchers in the area of data management, governance, and so on, and have some research done together. So each of the teams in those joint programming initiative are typically made up of researchers from many countries, so that they work together. So it's integrated right from the beginning. It's not a question of each country doing its own research or a reflection on this and then coming up with solutions that cannot be connected or are not interoperable, so to say, if we talk about like IDs like data. But so these things exist. These models, they exist. So we should probably use them instead of reinventing the wheel to address some of the challenge we have here. And even though I'm referring to a European Union model, in most of those joint programming initiatives, in fact, in all related to health, Canada is there, and many other countries like Australia, Brazil, and so on. So it's not a question of limited to the limits of Europe here.
Kim or Reza, would you like to comment on the international dimension?
Sure. I just before I go further, I'd just underline what Eve was saying. That I think that the EU approach to these, they're not only just multi-country, but they recognize that they tend to be bigger and longer-term projects, so that you can really get into the true meat of something. And then I would add to that if you buy the kind of proposition I put forward, that really the future is going to be in distributed infrastructure and distributed analysis, then I think in some sense this problem can solve itself. So if we can get to the point in Canada where we have a distributed infrastructure that allows multi-jurisdictional research, that doesn't necessarily force data to travel all the time, because frankly data sets are going to be getting so big that the data travel is not going to make an awful lot of sense. If we can solve that for Canada, then scaling that from working within a multi-jurisdictional system in Canada to being part of an international interjurisdictional system seems like a much smaller step than it might otherwise. So I think we can actually make a lot of progress on this.
Reza?
Yeah, I think it very much depends on the sort of issue, because if it's something where everybody agrees they want the same outcome, then it becomes easier to try to figure out how you can coordinate. But if it's something where there's inappropriate stuff that you want to stop, what's to stop about, one country from saying, oh, we're not going to have those rules, and then the guys who want to play those games set up in that country. So I think there's a whole lot of things that, yes, indeed, we can work together because everybody wants the results. But then there's some other stuff that may be more problematic.
Are there, I guess, a general question, are there lessons that we can learn from sort of our previous forays into areas like this in the life sciences? For example, in the area of dealing with genetically modified organisms, right, with GMOs and how that actually limits trade, it limits, and we have in Europe a particular approach, and North America approach, and Asia a different approach. So are there lessons we can learn from that?
It's a really tricky question. It's an important question, but this, to me, in some sense, this comes down to where is variability your friend and where is it your enemy? Because I think there's contexts in which it could be both, because it would, and pandemic is a pretty good example of that. All of a sudden we have several vaccines that maybe look promising, and they're quite different, at least they have a couple different varieties. And if we think about the production process for vaccines, it's going to be better if they aren't all the same, because it means that maybe we can get more produced more quickly because we're not relying on the same manufacturing process, ingredients, et cetera. Ingredients is probably totally the wrong word there.
Right.
But on the other hand, we can see where variability is really an enemy, because we have 13 jurisdictions, and if everybody gets to interpret things differently, then we'll go at the speed of the slowest jurisdiction. So I'm not really totally trying to dodge your question, but I think I don't know that it has a really simple answer.
One of the questions that's been raised from the public is, and again, it comes back to this point as to who's making the rules and how are we getting input. It's the questions in a comment. It sounds like there's a strong need for clear science, policy, health communication, so that the groups of people of the public who are affected by this are properly informed and have the option to join suggested tables. Do you want to pursue that comment a little bit more?
Eve, go ahead, please.
No, go ahead, Kim, go ahead.
I think so. There's a few layers to that. So one is we have an absolute obligation to be transparent with the public about what's happening, and not everything that's happening in the world of data use is with consented data. Because most of what we collect routinely in health and care system and social service systems actually can be used for research without consent. And that's a real advantage because it means we have population-based information, but it should come with an obligation that we should be transparent and clear about what we're doing, how we're doing it, what the results are, and so on. And there's a lot of work to be done there, because the world of consent forms for research participation would suggest that the plain language communication of things is still a bit beyond what we're capable of doing right now. So that needs to be changed. And then I think along with that, we do need to find ways of involving the public. I'm conscious of not thinking that every member of the public actually wants to be involved in these discussions. Some of us just want to let other people tell us that they think it's okay and therefore I can think it's okay. And that's absolutely fine because there's a lot of issues for us to worry about and we can't all be worrying about the same ones. But we do have to find ways of meaningful engagement and ongoing engagement. And that's, as Reza already raised, it's quite tricky because the people that we probably most want to talk to may be the ones that are most constrained with time, resources, and ability to engage.
There's also a key issue of trust. Because again, it's not an example of data, but with drugs, when we had the international supply chain, and you'd find cases where they just didn't have the active ingredient in it. They would, put together drugs, and to save money, they wouldn't produce them properly. And you had some of the, so again, if you're talking about the data or anything else, the vaccines for COVID, do you trust the data that's being put forward on it? So I think, again, as you start moving internationally, there's a big question to make sure, how do you make sure that the data you're getting is valid, that you can trust it, that it's going to be done in a way that's not just trying to make money for some people who figure they can cook it.
Yves, did you want to comment on it?
Yeah, you were saying who should be doing this. So obviously the answer is not singular, but it can be the full plural. So it has to be a process which is orderly and taking advantage of those who can lead the discussion, are inclusive, transparent, as Kim underlined. One example, I think, which I'm really which is extremely interesting is a recent work by the group of research directors of research centers of hospitals in the province of Quebec. As you know, we have a Quebec Health Research Fund, the FRQS, and very proactive. And altogether, they put together a committee where they reflected on the data governance and how to share data. But they also involved the ethicists, they involved, and they are now talking to all the partners that should be included as well. So it's not that everyone sat around the table first. There was at least a first draft on the table, but now there's a lot of consultation, a lot of discussion, and at the end, I think it's going to comply with the principles we want of transparency and inclusion and so on.
Could we just return briefly, or maybe not briefly, but to a comment that Reza made around trust, and maybe explore how that issue of trust, how does this relate to the public-private mix? And that is activities and data that are controlled by private organizations versus activities and data regulated by provincial, local bodies, whatever mechanism that you raised earlier around legislation. So could we talk a little bit about public-private piece and also get into the issues around trust?
So maybe I can just jump in and just mention that the word trust is also used now as an acronym for the trust principle for digital repositories. And so it's like the fair, but the trust. And interesting to see that it's an acronym, but it's also a concept. Relative to the private public, I think there's let's say challenges there. But one thing I would like to raise is some kind of tendency that seems to go on in certain area where the private will control more or less the public data. Let me give you an example. I was in Munich in January, just before everything fall on our head. And I was speaking with the head of neuroradiology there at the Ludwig Maximilian University hospital, big respected hospital. So, and they just had installed a new machine from a German MRI provider that I won't name. And suddenly she was telling me that in fact the kind of contract they're now requiring, this is a German builder in Germany from a university teaching hospital, which is absolutely world class, was that all the basic data from the MRI were not accessible to the hospital. They were fed into the company in order to develop algorithms, because obviously the goal here is in the future to sell services and not sell only machines. So we'll have to be, not only is there what's going on, but there's tendencies that are quite scary if we don't take them very early. So I think there's even new challenges that we would not have imagined recently.
Kim, Reza, would you like to comment?
Yeah, there was a neat example in a book chapter that I did with Monica Agarwal and Christian Gingras. And one of the things that Monica and Christian found is that Target stores in the US use big data and an AI algorithm to predict when a customer was pregnant based on what the purchase habits would be around certain products. And they use that to send coupons for diapers or other activities to those targeted customers. And when they found they were doing it, they didn't stop it. They just put additional random coupon offerings in. And it turned out to be legal under the US because Target stores were not a covered entity as defined by the Act. So, you know, here's an example. I guess there's nothing particularly horrible about using, you know, getting a free coupon, but the question of whether you can use purchasing habits to a store and use algorithms to try to decide what health issues you've got has some interesting implications.
Yeah.
Kim, do you want to add on that scary example?
I'm going to leave the scary example alone. I think what I'd like to do is first of all, on the trust piece, differentiate trust from being trustworthy. So the trust is the thing you earned by acting in a trustworthy manner. So we will only get there if we're transparent and if it's clear to people what we're doing and if what we're doing is consistent with public values. So again, this kind of comes back to needing to involve the public in these conversations and make sure that we all kind of have the same understanding of what's happening. On the public and private side, and of course this is absolutely related because trust and trustworthiness kind of slide the scale when you're talking about public versus private data. But I think the important thing to underline here is that the private sector and private data are really, really not homogeneous at all. I mean, we used to think, I think, in the world of health research, we used to really just think about private sector equals pharmaceutical company. That was kind of I know it's a bit of a shorthand, but that was a big feature of how we thought about things. But now in the private sector, the example that Eve gave is absolutely fantastic. But then there's also Fitbits, there's diabetes monitoring data, there's Google, there's social media, there's shopping habits, as Reza raised. Those are all private sector data that may be relevant for research and may give us some clues about health, and that they need to be thought of differently. And that's not even touching the technology private sector and the owners of EMR systems and the vertical integration, which is meaning that they're owning some of the data involved in those EMR systems as well. So if we want to use those data, I think it comes down to trying to figure out how we work together between the public and private sectors. It seems hard to imagine that we can not confront that situation, and how we bring the public into those conversations to make sure we get the balance right.
Can I just dive a little bit deeper into that, just for a second? I mean, with the with the diversity of medical devices, diversity of diagnostic equipment that we have, all linked in essence through the Internet of Things, and all the data, in essence, not necessarily being seen at different levels. Is there some sort of blockchain mechanism that we can figure out for the veracity of the data that is common? In other words, how do you deal with the question, Kim, that you're talking about in terms of and Eve raised about the reliability issue? Because you're only seeing filtered content, and you may want to see the zeros and ones behind that. Eve?
Well, maybe related to this question. Sorry, Ed. The one thing is okay. So the private data, how to bring them into reasonably and in a trusted manner into the kind of a public research area, but there's also the reverse, I would say. So what about allowing access to private companies to public health data? And recently we had a very good meeting with all the public health data users here in my university, and we were trying to write a kind of a two-pager on what should be the principle for access to health data, which is not without challenge in my jurisdiction. And one question we had was, so what about private companies having access to health data and public health data? And to my surprise, all the researchers who are quite knowledgeable people said there's no problem. But so the question is not necessarily private public, it's the ultimate finality of the use of those data. And so the analysis or the reflection on this should be more than simply, is it private, public, is it on the left, on the right, who has access? But the most important, according to the discussions we had together, is the finality of the use of those data. Is it to the benefit of the collectivity or not, and so on and so on. So it creates the more you advance, the more you have layers of reflections that are adding.
And I think it's important also to distinguish what we mean by public and private, because public can be how you pay for things, and as opposed to how you deliver, because doctors are all private in Canada. There's almost no doctors that are state employees. The other thing is, if you're talking financing, are you talking, for-profit, not-for-profit? So again, hospitals in most of the provinces are private, not-for-profit organizations. So there's a difference if I have a financial incentive to try to have particular outcomes, as opposed to if I'm simply trying to find out what the truth is.
We talked a little bit about trust, and maybe we could do is shift the discussion just a little bit to talk about another dimension of it, and that is, what are the determinants of the risk-benefit equilibrium analysis with regard to health data? And in other words, how do we establish data governance in a way that will help us derive the benefits of digital health while mitigating the risks, including, as Kim mentioned earlier, some of the unintended consequences of it?
Well, I think the equation first probably has some floor effect or ceiling effect. There's areas you don't even want to consider. So privacy of data is certainly not negotiable, and you have to be sure. And we heard in some of the panels this morning how data could either explicitly, directly, or indirectly allow the identification of the person, and so on. So all this should be certainly be adhered to and agreed upon as a basis for that for that cost for that equation. The rest of the equation has not only ethical and philosophical aspect, it also has, I would say, practical aspects. If accessing data in a way that is responsible, respecting privacy, but takes approximately 2.5 years to have access to the data, then there is a question here about the ethicity of not allowing the whole population benefit from the potential outcome and advantages of such analysis. It's also, from a academic point of view, incompatible with any master level work, since the accessing data will be longer than the time allowed to complete a master. So, so there's many aspects in this equation, which are, of course, in terms of philosophical and ethical, and in terms of the responsibility, but there's also very practical aspects in that equation.
So, Yves, what would you say, though, if you find out that somebody has an infectious disease and might spread it to other people? Does privacy mean that people cannot be notified that this person is dangerous?
Well, this is relatively taken care, I think, in the fortuitous findings in data capturing. So I'm a cognitive neuroscientist by training, and when we do scans, brain scans with people who are normal, if there's something that is to be found, all this has been planned in advance, and in the form, consent form, the patient and the participant to sign, it's clearly written that if something is found, that we will either we will or we will not, according to the decision of the participant, inform the GP or the doctor that is taking charge of this patient. So this you have to build this into the data cycle as early as possible, because if you have these questions later in the cycle, then you're really in the bad position.
Kim, did you want to comment on the benefits and risks?
Sure, yeah. So on the trade-off, and I feel like before saying more, I need to put my my priors on the table, which is that I think the only ethical thing to do is to use the data that we have to help improve services. And I'm talking particularly, I guess, about the public sector data here, though I'd like to extend that further. If they exist and we can use them to good benefit, then we should do so. So that's kind of my starting assumption on all of this. So you can tell from that I would argue that what we need to do is we're not going to eliminate risk, but we need to mitigate risk in some way, because eliminating risk means not using the data, except that I would say that the counterfactual is never discussed. We never talk about the cost we pay for the slow nature of data access and use. The fact that when we're not using data and improving services, people suffer consequences there too. So this is not a net zero sort of thing. We have to bear that in mind. And then I think I really do think that the 5 safes framework provides a really nice way to think about the risk benefit trade-off, because what that 5 safes framework says is that you can think about the different aspects of a project. There's a safe project, safe people, safe data, safe environments, meaning the place you're going to do your research, and safe outputs. So if we can think about what we consider to be safe in each of those dimensions and add it all together, then we'll have a better sense of how risky something is and whether the risk is worth the potential benefit that might come from any particular project.
Kim, is that 5 space framework commonly adopted on an international scale? Because clearly we want to think about how given global trends and ownership and things like that, how can we actually share these data and use these data productively across boundaries? But also then, how do we govern the systems of data that might cross those jurisdictional boundaries that we've talked about? That as we move to a more federated system, how do we ensure that the governance principles or the mitigation principles you're talking about actually can be applied?
Yeah, so this framework was, I think, first developed in the UK. It's been adopted in Australia. It's being used in Canada and various places. And So yes, it has that. And I would say then two things in addition to that. This needs to be paired with other things like OCAP or the CARE framework that's now the international standard, which speaks specifically to Indigenous data sovereignty principles. So this plus the particular attention to Indigenous data sovereignty, and by extension, community data sovereignty over to more sensitive data. So you kind of have to put a couple frameworks together on this. The other thing I think is really important to say is that these frameworks are just that, they're frameworks, and each jurisdiction or locality still has to put the particular rules in that they want to, that, you know, the definition of what a safe person is or what a safe project is up to the local jurisdiction. But if we're using the same framework and an individual in each jurisdiction can decide whether something is worth proceeding or not, then I think it does relate to then your question about being able to collaborate internationally using kind of a common approach, even if the specific rules under that are a bit different.
Yves or Reza, would you like to comment?
Yeah, about this trust risk kind of equation. One thing that we didn't mention is, of course, the importance of the public understanding what are those risks, what are those assurance that are given, and where this delicate equation is ending. And I think this emphasizes the importance of literacy of the public in these areas. I was quite impressed listening this morning that Finland was having a couple of courses for the public on what's AI and explaining to the public what it is and so on. I think certainly we should do that, and I think the public would be very receptive. But I think it should be also on topics such as data governance, how data are secured, how they are stewarded, and so on, and to explain and to share the challenges, but how these challenges are managed. As Kim was saying, these challenges cannot be simply eliminated by simply putting a big cover on those data, because then it would be non-ethical to not to use them for the benefit of of all. So, but there's a sweet equilibrium here, which is very complicated, but still the public should be probably much more aware and more participative in this, including in offering the opinion of the public on governments for the different policies and laws to be updated in relation to this equilibrium.
But there's also the whole trade-off between what an individual might want and what most of the society would. Like, for example, if I happen, which I'm not, if I happen to be COVID positive, who should know that? And, you know, if I'm asymptomatic, does that mean everybody should know it and there's some way of knowing to try to keep me from traveling, spreading, etc.? You had the same issues in the early days of HIV. If you were positive, how should that information? And people would say, no, it's my right not to tell people, but then they'd infect and kill people. So it's a really difficult thing of how do you balance off the individual privacy rights with the fact that you could be putting other people at risk. And then if you're talking about taking the data and trying to use it, I mean, certainly with rare diseases, a lot of the people with rare diseases love the idea that even if it wouldn't help them, it might help the next generation of people with that disease to take the information and use it. But you're usually not going to have enough cases in any one jurisdiction, so you've got to be talking about collaborating. So it's this balancing off of the individual rights versus what society would want, with what particular groups might want, and it's not simple.
Would panelists like to touch very, very briefly on sort of the reliability aspects? Because, you know, we referred earlier to health data coming with metadata and other pieces that are attached to it, all of which are easily manipulable as it moves through some sort of chain. Can we talk about some things around the data ontogeny and the reliability aspect and what might need to be put in place in that federated system? Or how do we actually go about doing that? How do we rely on the quote unquote truth? Just a brief comment, if you would.
What is truth, Ed?
Yeah, exactly.
So
not a question to ask to the Royal Society.
And again, I don't mean to sound like I'm trying to avoid the question, but I really truly believe that reliability of data, and particularly when we're talking in so many cases in this big data world, we're talking about data that were not collected for purposes of research. They're collected it's been described as the exhaust of everyday life, and we're gathering all of that up and using it for research. And in that context, I think reliability is much more about fit for purpose. The data are not going to be full stop either reliable or not reliable. It's going to be reliability in relation to the question you particularly want to ask at a particular point in time. And that's why I rely on the idea of metadata, and metadata meaning both I'm going to describe the contents of my data, but I'm also going to describe the provenance, what population it comes from, what time period it covers, how we collected it, who's in and who's out. That information is really fundamental for deciding whether the data that you're going to use is actually reliable for the question you're posing.
Great.
I might want to just mention that as a counterpart of what Kim was saying, that I would say, of course, but at the same time, the granularity of the data is extremely important right from the beginning and from the start of the capturing the data, because then the flawness of the data will become more and more big if you go to the meta-analysis level. One example, I don't know, one example of a data is, let's say, number of people in Canada who are deceased because of Alzheimer's disease. Well, there might be very few, just because this is not a condition that is associated with death, except the accompanying conditions are causing death. So it's a very so that's why the granularity would be important in this particular case, but fully understanding what Kim was saying.
Reza, any additions on this?
No, but do people know how to ask questions, or?
Yep,
Okay.
they're coming through the chats.
Okay, good.
So all three of the panelists mentioned in their opening comments the importance of equity, diversity, and inclusion. And so I guess one of the questions I think we want to address is, how can we organize data and data governance in a way that acknowledges systemic biases and respect as well for data sovereignty, and helps to achieve commitments to equity, diversity, and inclusion? And we mentioned earlier the FAIR principles. So maybe I could open it up for some general observations on that.
Well, if I can just follow up on what I was just saying, I think it comes right from the beginning, as I was saying in the conclusion of my initial statement. If it's not, if the EDI principles are not taken into account right from the beginning, then it's going to be difficult to not to account from them later on. Except if you try to compensate and see what are the impacts, or where is the missing equilibrium in terms of equity, diversity, and inclusion, where this is one way of doing it, but I think it's a palliative way, and it might be biased in some cases. So I would say let's try to address this question right from the beginning, and of course have it included in the governance level, the stewardness level, all the levels that follow.
Reza, did you want to go next?
This is one of the things I don't think I have anything expert to add. So,
okay.
No.
Kim?
So I'll start by, I mean, the fundamental challenge in all of this is that data can be used equally for good purposes or malign purposes, and the tension that we are experiencing now in the equity, diversity, and inclusion realm is, on the one hand, sunlight is the best disinfectant, and we need to know things about people's experience in those equity dimensions in order to understand the problem and to be able to address it. At the same time, those data have been used for purposes of oppression, discrimination, and systematic bias in the past. So how do we solve that issue? And I'm going to outline the recommendations made by a report that's recently completed by the BC Human Rights Commissioner's Office, because I think they, in the space of June to September of this year, did an enormous amount of consultation, wrote what I think is a very elegant set of recommendations. So first, a piece of legislation, which they called the Anti-Dated Discrimination Act, which would kind of like the genetic discrimination legislation that has been put in place in many jurisdictions. This would say that you just can't use data to discriminate, full stop. Second, that data that reflect equity, diversity, and inclusion facets, particularly for individual level information, must be community governed. So it would be accessible for use and analysis or for research only at the pleasure of a panel that would decide and okay its use. And that panel would be made up of community members. And that part of the application process for using those data would be an equity impact assessment. So again, it's clear that the intent of using the data is to address, redress, correct inequities, and that you have a clear plan for how you're going to do that. And it's only under those conditions that you could use the data.
Any other comments on that? So coming back again to this notion of raising this to the international level, how, and from a practical point of view, maybe we can discuss how we could foster more collaborations between countries in digital health in general and on data more specifically. And Kim, you talked about, light is a purifying element, but could we talk a little bit more about how we foster those collaborations? Yves?
Well, I did mention some examples earlier, but there's one loophole with the examples I mentioned, and it's that people have to, or people that could be brought together, have to know they exist in the other country in order to decide to work together. So there's always a first phase to these enterprise, which brings together people from different countries to work together, because either they're decided by country authorities and they know as much as they know in terms of who would be the best person to put in those joint ventures, or they are at the root level because people know who they should be working with, or they don't know because they simply don't know. So I think that one preliminary aspect or step in those enterprises is to make sure that there are means for people to know each other. Some years ago, we wanted to foster, for instance, research on aging between Canada and Brazil, and nobody was knowing nobody else in the other country. So what we did is that we contacted most of the Canadian and the Brazilian research centers, and we did some a kind of a Zoom for about an hour with an elevator pitch of a minute or two by each of the teams, so that there would be at least a pre-knowledge of who's doing what in terms of. So this is a very practical answer, but it's a necessary one if we want to bring together people, because they have to know who they could work with.
Kim or Reza, any comments on that?
Also, don't underestimate the time and the funding, which is to work with some of the data sets would take a long time to get it approved and a lot of money to get the access to the data, whereas in some other provinces, it was quite easy.
Kim?
Yeah, this is a tricky question, and Yves is for sure, given his past experience with CIHRs, that the real expert on this. I would say, and I think Yves kind of touched on both of these things. There's one approach, which is that international groups are constructed. So I have the great honor of being part of the Global Partnership for AI, which was put together by France and Canada, I think, are leading this, but involves 15 countries. And that was kind of a constructed group around a particular topic. So it's bringing people together who didn't know each other, but it's giving a platform and a timeline that is going to enable collaboration. And there's going to be some real projects done under that. So that's one way to do it. The other is to provide funding and let people, or help people, as Eve described, help people find each other, but you provide them with funding. I think the other thing that would be really helpful in this space is to have a little more risk tolerance than we do right now. Funding applications they have low probability of success in the research world, and we have a high expectation for research productivity and output. So I think that, with the exception of the New Frontiers and Research Foundation, which specifically was about high risk and high impact, it's really hard to try to do things, and particularly internationally, if you're not absolutely sure they're going to work, which means that they're almost by definition not the most innovative thing that people might be trying to do.
One of the comments and questions from the audience is clearly health data are extremely valuable, and how long it remains so seems to receive little discussion. If long-term or indefinite retention is important, are data governance methods and technologies meeting that need that we have?
Yeah, I mean, I do think that they have a very long life, depending again on the application. I think what I'm learning about AI approaches is that sometimes we actually need more recent data, and the older data may not be as valuable because, of course, systems change, the context changes, and so if you're running a prediction model, it's probably not going to work so well if you're using very old data. In my kind of home world of health policy evaluation, health services research, I really love the long longitudinal data because it really helps you understand trends and not just the very narrow band that you might be looking at right now. So, and I don't think that the data governance approaches are different for the longitudinal nature of the data than they are for the recent data. So if you can get it right for the most recent data, I think we can just expand that.
Eve or Reza?
Well, regarding the longitudinal data, I think we have a vivid experience of that in Canada. The Canadian longitudinal study on aging is a nice example. Yeah. This is a 20-year-long, 25-year-long study, and data governance is not one of the smallest challenge of such a study, indeed. So, for instance, the co-PIs, and I salute them, who initiated this 10, 12, 15 years ago, might be not there when at least not in their university, I mean, when the study will end. And so what is the exact role, the trustee role of the university in which these data are standing now, and how they will be put forward in order to follow up on the benefits for all the other researchers in Canada to have access to this unique database. So this I think we need more long-term funding, but at the same time it will raise another set of challenge, which is not really different, but some other answers to the same set of challenges. And certainly the universities will have to be very proactive there.
Yeah, it depends very much on the questions you're trying to answer. Like if you want to know what happens if you get a particular disease, then the longitudinal data is absolutely critical. Some of the work we did on who the high cost spenders were, again, to see how much of it was one-shot spending and how much of it was continuous. So certain questions you absolutely need longitudinal data. And for other ones, Kim's absolutely right, you want more recent data.
So coming back to the issue that raised earlier about making the rules and the public consultation piece, do we have confidence in, that these data are going to be used massively around the world? Do we have confidence in the systems in place to protect individual privacy as we deal with data both within our 13 jurisdictions in the country, our country, and internationally?
Again, it depends, because if you're talking very rare conditions, then, sometimes this is the ones you have to say, no, you can't report this data together. You got to merge it because there's too few people in this cell and it would be too easy to identify them. So for certain things, yeah, it becomes problematic. And for other things, no, there's enough people there that you can keep the privacy.
I would say, following up on what Reza just raised, that's where working together and merging in larger pools, even in rare diseases, might be not only a solution for science itself, but also a way of moving the needle on this risk equation of identifying the person. If the pool is larger and some of the parameters are not taken into that pool, that would be indirectly contributing to the identification of the participants, then you have an advantage again for international collaboration.
Kim, any comment?
Yeah, I think it's important to distinguish between the privacy protections that are necessary in the process of doing the actual analysis and privacy protections for the outputs of those analyses. So, and on the latter, absolutely, we need to make sure that when we're publishing things, we're not putting things out into the world that could easily identify either a community or an individual. And there have been some mistakes made in that previously. In terms of the identify or potential identifiability of data during the research process, we can do lots of things. We could obfuscate data, although that minimizes then the power of the data to some degree. But really, this is why we have the whole system of protections in place. We don't rely on one thing. We don't rely on anonymizing the data only. We rely on making sure that you're a bona fide researcher, that you have training, that you understand your responsibilities as well as your rights, that you're doing your data in a protected or your analysis in a protected environment, that the project you're doing has peer review. So with all of those things in place, I think we can maybe worry a little bit less about the data themselves, because these data are never going to have names or a direct identifier associated with them. What we're talking about is sort of the mosaic effect of being able to say this person in this hospital with this condition on this date in this area, and somehow I can figure out who that is. I think the whole system of protections is how we should deal with that. But it also relates to why I think that the distributed nature of data is a good thing, because then the data can continue to be protected by the local norms and legislation. But somehow we have to do that while accommodating the really important points that Eve and Reza talked about with small populations and rare outcomes and rare conditions.
Thanks. Well, I promised the panelists to have time for some closing comments. And so what I'd like to do is to actually do the reverse order of the original presentation. And maybe I could ask the panelists to give some salient observations that I'd like the audience to take away on the data governance scope, reliability, and access issues. And Eve, maybe I could start with you this time.
Thank you. And I think I've learned a lot from this panel, thanks to, and from the other panels this morning. So I think the Royal Society of Canada and the G7 group has certainly made a good choice for this, to organize this this meeting. I think we learned a lot about challenges at the level of the whole data cycle and solutions as well. And one thing for me, which is, of course, important, is our ability to transform some of these differences in diversity in how things are done across jurisdiction and countries into strength, and to try to learn from each other. One thing that we did not mention enough probably is the fact that training is important. We mentioned it, but the culture, the evolution of the culture and the academic culture, which is the backdrop of all this, will have to be addressed. It's the most complicated, the most difficult, because culture is really the last to change, so to say. You can change a policy, but changing a culture is complicated.
Kim?
So I'll just start the same as Eve and say I've learned a lot. It's been really fascinating to be part of all of this from the beginning. So I do thank to the organizers and all of the other presenters and my fellow panelists for the opportunity to be part of this. And then I pick up on what Eve said, which is that the culture piece is so fundamentally important. And I don't know that we've had enough conversations within the scientific community about the need to really change the way we do science. I really do think that science of the future has to be more collaborative. It has to be more oriented to sharing. It has to be more about bringing data sets together at the beginning of projects, not just at the end or never. And then I think, you know, all of these conversations sort of underline, although implicitly to this point, that the hard parts of all of this are probably not technology. Technology is coming along. There's lots that's available to us. There's lots that can be built, and there's really clever people who can write software and build things that we need. The hard part is the policy piece, and even more so, getting a collective buy-in and agreement that will endure over some time, so that we can actually put some of these things in place. Because to make the changes we're talking about really is a multi-stakeholder adventure. It needs a big tent and a big party to come along, and it does need collective voice and collective action. I think that's the only way we're going to be able to move forward.
Reza?
Yeah, I very much agree with the other panelists. And I think one of the things that's quite clear is one size does not fit all. And we don't really have the infrastructure in place to try to make sure that, you know, the data is there in a sustainable way with easy ways for people to access it, and to make sure that important questions can get answered ethically and in a fairly fast manner.
Great. Thank you, Reza. And thank you so much to all of the panelists today. I think you've raised the level of discussion on this topic. You've created both productive and constructive ideas that I think will feed into the future of digital health. And I hope will feed into the sort of the G-Science Academy statement, and as it's developed and as it moves forward through the various pieces. I want to thank everyone for participating in the discussion, and also really, really appreciate the members of the audience with the questions that are coming forward. I hope you enjoyed the discussion as much as we did. So thank you very much. And I know there's an upcoming panel on winning conditions for scaling digital health innovation. And hopefully this panel will set the stage for the next one. So thank you very much, everybody.